Okay, next we're going to talk about allergies, asthma, diabetes, and arthritis. Cardiovascular disease and cancer are two of the most deadly non-communicable diseases. Other non-communicable diseases are chronic, meaning that they are present continuously or reoccur frequently over a long period of time. Allergies, asthma, diabetes, and arthritis are chronic diseases that affect millions of people. Some, such as allergies, asthma, and certain types of diabetes, are caused by a response of the immune system. Others, such as osteoarthritis, cause the breakdown of bone cells and tissues. So first, let's talk about allergies. Allergies. The sneezing and runny nose, often associated with a cold or sometimes a response to substances in the air. An allergy is a specific reaction of the immune system to a foreign or frequently harmless substance. Allergies are among the common causes of illness and disability in the United States, affecting 40 to 50 million people. Pollen, foods, dust, mold spores, chemicals, insect venom, and medicines are some of the more common allergens or substances that cause allergies. The body treats these allergens as foreign invaders. Antigens on the surface of the allergens bind to special immune cells in the lining of the nasal passages. These cells release histamines, which are chemicals that can stimulate mucus and fluid production in an area. Histamines produce the sneezing, itchy eyes, runny nose, and other symptoms that make a person with allergies uncomfortable. Some people have an allergic reaction that produces hives, which are itchy raised bumps on the skin. Others have serious reactions to allergies that sometimes can be life-threatening. Severe symptoms include hives, itching or swelling of a stung area or the mouth, and difficulty breathing and swallowing. Other severe symptoms might be a raspy voice, swelling of the tongue, and a sharp drop in blood pressure, which can cause dizziness. If someone you know experiences any of these symptoms after eating food such as peanuts or shellfish, or after being stung by a bee or wasp, seek medical attention immediately. Now let's talk about diagnosing allergies. Sometimes you can diagnose an allergy yourself. You may notice that when you are near certain kinds of plants, you sneeze, or eating a particular food makes you break out in a rash. In some cases, tests are required to determine the cause. Three common methods are used to identify the source of an allergic reaction: a blood test, a food elimination diet, and a skin test. During a skin test, the skin is scratched and small amounts of possible allergens are applied. If the person is allergic to any of the allergens, the skin in the area of the scratch swells and turns red because of an inflammatory response. Now let's talk about treating allergies. Sometimes allergy treatment can be as simple as avoiding the allergen. This is the best treatment for severe food and insect sting allergies. When avoidance is not possible, medicines including antihistamines that help control the symptoms triggered by histamines may be suggested. People with long-lasting or severe allergies should seek medical attention. Allergies can irritate the respiratory tract and lead to other health problems, such as asthma. People with severe allergies may receive immune therapy, a series of shots that contain small amounts of the allergen to which the person is sensitive. The injection causes the immune system to become less sensitive to the allergens. Experiencing unpleasant reaction to something you eat does not necessarily mean that you have a food allergy. For instance, lactose intolerance is not an allergy. Because symptoms are similar, this is a common misconception. In reality, only a very small percentage of people actually have proven food allergies. For those who do, the main method of treatment is avoiding the food that causes the allergic reaction. This usually requires diligently reading ingredient lists. Let's talk about asthma. So some allergic reactions can lead to asthma, which is an inflammatory condition in which the small airways of the lungs become narrowed, causing difficulty breathing. More than 17 million people in the United States have asthma, and each year more than 5,000 Americans die of this disease. Asthma can develop at any age, however, about one-third of those with asthma are under the age of 18. The bronchial tubes of people with asthma are sensitive to certain substances called triggers. Common asthma triggers include air pollution, pet dander, and tobacco smoke, as well as microscopic mold, pollen, and dust mites. In an asthma attack, the asthma triggers cause the muscles in the bronchial walls to tighten and produce extra mucus. The respiratory passages narrow. The results can range from minor wheezing, breathing with a whistling sound, to severe difficulty breathing. In some cases, the condition becomes life-threatening. Now let's talk about managing asthma. Although asthma has no cure, most people with the condition can lead normal lives by behavior changes and proper use of medication. People with asthma can lead normal, active lives with proper management that include the following: monitoring the condition, recognize the warning signs of an attack: shortness of breath, chest tightness or pain, coughing or sneezing. Treating the symptoms quickly can help prevent attacks or keep an attack from worsening. Manage the environment. Reduce asthma triggers in the environment. Avoid exposure to tobacco smoke, eliminate carpets and rugs when possible, and wash bedding frequently. You can manage stress. Stress can trigger an asthma attack. Relaxation and stress management techniques can be helpful. And take medications. Medication can be used to relieve symptoms, prevent flare ups, and make air passages less sensitive to the asthma triggers. A bronchodilator, a type of medication taken with an inhaler, relaxes and widens respiratory passages. Now let's talk about diabetes. Diabetes is a chronic disease that affects the way the body cells convert food into energy. Each year, approximately 1 million new cases are diagnosed. There are no cures for diabetes. In a person with diabetes, the pancreas produces too little or no insulin, or hormone that helps glucose enter the body's cells. In some diabetics, adequate insulin is produced, but cells don't respond normally to it. For the cells in the body to function, they need a constant source of energy, or glucose, from food. If glucose is not converted to energy, it builds up in the blood and cells do not get the glucose they need to function. The only way to diagnose diabetes is through a blood test. Early detection of diabetes can prevent serious side effects such as blindness. Diabetes is the main cause of kidney failure, limb amputation, and blindness in adults, as well as a major cause of heart disease and stroke. These effects, however, are not inevitable. If diagnosed, the disease can be successfully managed with medication, a healthful diet, and regular moderate exercise. In many cases, diabetes is preventable. Now, there's two types of diabetes. The first one, type 1 diabetes. Type 1 diabetes, which accounts for 5 to 10% of all diabetes cases, appears suddenly and progresses quickly. The body does not produce insulin and glucose builds up in the blood, starving cells of the energy they need. Over time, the high blood sugar level can cause damage to the eyes, kidneys, nerves, and heart. The cause for type 1 diabetes is not clear. Some scientists suspect an environmental trigger, perhaps an as yet undefined virus, that stimulates an immune response, destroying the insulin producing cells of the pancreas in some individuals. People with type 1 diabetes must take daily doses of insulin, either through injections. People with type 1 diabetes must take daily doses of insulin, either through injections or through a special pump that is attached to the body by tubing or that is surgically implanted. Today, because of advanced treatment methods, many people with diabetes are able to live near normal lives. Next, type 2 diabetes. Type 2 diabetes accounts for 90 to 95% of all cases of this disease, and most often appears after age 40. However, type 2 diabetes is now being found at younger ages and is even being diagnosed among children and teens. In this form of diabetes, the body is unable to make enough insulin or to use insulin properly. Buildup of glucose in the blood causes many of the same symptoms as type 1 diabetes. Type 2 diabetes is nearing epidemic proportions in the United States because of an increased number of older individuals in the population and a greater prevalence of obesity and inactive lifestyles. A diet high in fat, calories, and cholesterol increases the risk of diabetes. Thus, choosing lower fat, lower calorie alternatives can help reduce the risk of this disease. Increased physical activity also reduces risk because it helps control weight and lower blood cholesterol levels. Treatment for type 2 diabetes includes weight management and regular physical activity. Individuals with the disease must carefully monitor their diet in order to control their blood sugar levels. In some cases, oral medications or injections of insulin are required to manage the disease. And then next we want to talk about arthritis. Arthritis is a group of more than 100 different diseases that cause pain and loss of movement in the joints. It is one of the most common medical problems in the world and the number one cause of disability in the United States. More than 1 in 6 people suffer from the disease. Arthritis is more common in older people, but it can affect anyone, including children and teens. In fact, 8.4 million people between the ages of 18 and 44 have arthritis, and millions of others are at risk of it. First, we're going to talk about osteoarthritis. Osteoarthritis is a disease of the joints in which cartilage breaks down. Cartilage is the strong, flexible tissue that provides cushioning at the joints. In this disease, the cartilage becomes pitted and frayed. In time, it may wear away completely and bones may rub against each other. Although osteoarthritis affects primarily the weight-bearing joints of the knee and hips, it can affect any joint, including those of the fingers, lower back, and feet, causing aches and soreness, especially when moving. Osteoarthritis is one of the most common types of arthritis, in fact. It accounts for half of all arthritis cases. It affects about 20 million people in the United States and is most common in women and in people over the age of 45. Many people think that arthritis is an inevitable part of aging. However, several strategies reduce the risk of osteoarthritis. First, controlling weight. Maintaining an appropriate weight reduces stress on joints by lessening wear and tear on cartilage. 2. Preventing sports injuries. Warming up before exercising, adding strength training to your physical activities, and using appropriate equipment, including wrist guards and knee pads when necessary, help avoid joint injuries and damage to ligaments and cartilage, thus decreasing the risk of osteoarthritis. Let injuries heal completely before playing again. Third, protecting against Lyme disease. Lyme disease, which is spread by the bite of infected deer ticks, if left untreated, can result in a rare form of osteoarthritis. Using insect repellents, wearing long sleeve shirts and pants when walking outdoors or in wooded areas, or being educated on tick recognition and removal can help reduce this risk factor. And then we have rheumatoid arthritis. Rheumatoid arthritis affects 2.5 million people in the United States. It is 3 times more common in women than in men. Symptoms usually appear between ages 20 and 50, but the disease can also affect young children. Juvenile rheumatoid arthritis is the most common form of arthritis in children. Rheumatoid arthritis is a disease characterized by the debilitating destruction of the joints due to inflammation. Like type 1 diabetes, this type of arthritis is caused by an autoimmune disease for which there is no cure. Sufferers are likely to experience joint pain, inflammation, swelling, and stiffness. Eventually, the joints may become deformed and cease to function normally. Rheumatoid arthritis affects mainly the joints in the hand, foot, elbow, shoulder, neck, knee, hip, and ankle. Other effects include fever, fatigue, and swollen lymph glands. The effects of this disease are usually symmetrical. Both sides of the body develop the symptoms at the same time and in the same pattern. Early diagnosis of rheumatoid arthritis is crucial. With the use of medication, in many cases, the effects of the disease can be controlled. Treatment methods focus on relieving pain, reducing inflammation and swelling, and keeping the joints moving as normally as possible. A combination of exercise, rest, joint protection, and physical and occupational therapy also can help manage the disease. Now we're going to talk about physical and mental challenges. So think, does our school have ramps and special restroom facilities to accommodate people in a wheelchair? Are there telephones for people who are hearing or vision impaired? Have you seen a closed caption television program? All these devices are designed to offset a disability, which is a physical or mental impairment that limits normal activities, including seeing, hearing, walking, and speaking. According to the latest U.S. Census Bureau statistics, almost 20% of the adult population has some type of disability. People with disabilities sometimes have difficulty doing things that others take for granted. The challenge may be physical, such as climbing stairs, seeing a sign, hearing a conversation, or holding a package, or maybe mental, such as understanding simple instructions. So first let's talk about physical challenges. The most common types of physical challenges affect a person's senses or the ability to move and get around easily. Most physical challenges may be classified as sight impairment, hearing impairment, or motor impairment. So first let's talk about sight impairment. Like other disabilities, sight impairment can be moderate, as for the more than 5 million Americans who are visually impaired, or it can be severe, as for the 1.3 million people who are legally blind. In addition, an estimated 1.8 million people in the United States are unable to see words and letters in ordinary print, even when wearing glasses or contact lenses. Although visual impairment is more common among older adults, nearly 1 in every 1,000 children has partial vision loss or is legally blind. The leading cause for blindness is the result of complications of diabetes. 3 other common causes of blindness are macular degeneration, which is a disease in which the retina degenerates. It is the leading cause of blindness in individuals over 55. Glaucoma, a disease that damages the optic nerve in the eye, or cataracts, a clouding of the lens of the eye. Regular eye exams are important for people of all ages. The early diagnosis of many conditions can help prevent blindness or slow its progress. Next, hearing impairment. About 20 million adults in the United States have disabilities that affect their ability to hear, and as many as 2 in every 1,000 children have a significant hearing impairment in both ears. Like sight impairment, hearing problems can range from minor to severe. Profound deafness is a hearing loss so severe that a person affected cannot benefit from mechanical amplification, such as a hearing aid. One cause of deafness is heredity. Other causes are injury, disease, and obstructions, which can prevent sound waves from traveling to the inner ear. Obstructions may be caused by a buildup of wax, bone blockage, or something stuck in the air. Some individuals are born with an inherited abnormal bone growth in the inner ear that may cause obstruction. Obstruction usually affects only one ear. Surgery can cure many of these cases. Hearing impairment caused by nerve damage often occur with age, but also can be a result of repeated exposure to loud noises such as stereos, traffic, video games, and some machines. Going to one Going to one loud concert or blasting the stereo occasionally probably won't hurt your ears, but prolonged exposure to loud music can cause hearing loss. In fact, some experts think that hearing loss is occurring much earlier than it did 30 years ago, possibly because of the increase in environmental noise. This type of hearing impairment can be gradual, so if you have noticed your hearing has changed, it may be time to visit an audiologist or a specialist in hearing problems. Then we have motor impairment. Tasks that are simple for most people, such as tying a shoe, climbing the stairs, opening a jar, or lifting a glass, can be a challenge for someone with motor impairment. Motor impairments result when the body's range of motion and coordination are affected by an injury to the brain or a disorder of the nervous system. Physical therapy often is used to help those with motor impairment. Through physical therapy, the joints are kept flexible and the muscles stretched, improving the individual's ability to move around. Physical therapists can teach people to use their assistive devices. For example, people with limb amputations can be fitted with a prosthetic or artificial limb. Motorized wheelchairs allow many people with motor impairments to get around without assistance. Computers can be adapted in many ways, such as with mouth sticks or head sticks to those unable to use their hands and arms. Then we talk about mental challenges. Some challenges affect a person's ability to live independently in society. One such challenge is mental retardation, which is the below average intellectual ability present from birth or early childhood and associated with difficulties in learning and social adaptations. This disability affects about 3% of the population, but many of those with the challenge are only mildly affected. Such individuals, who make up 75% of the mentally retarded population, cannot be outwardly distinguished from non-retarded people. Several factors have been found to cause mental retardation, including injury, disease, and brain abnormality. Some factors are related to genetic disorders such as Down syndrome, PKU, Tay-Sachs, and Fragile X syndrome, the most common cause of genetically inherited developmental disability. Behaviors during pregnancy are another important factor. Pregnant women who use alcohol or other drugs greatly increase the risk that their babies will be born with mental retardation, low birth weight, or fetal alcohol syndrome. Another preventable risk factor during pregnancy is infection with rubella. Immunizations against the disease, either during childhood or within 3 months of becoming pregnant, reduces the risk. A restricted supply of oxygen during birth may cause mental retardation. In older children, it can result from a head injury, stroke, or certain infections such as meningitis. Let's talk about accommodations for the differences. People with physical and mental challenges have the same needs and interests as do the rest of the population. They also have many of the same abilities. Historically, people with disabilities have been viewed as a separate population. Fortunately, in recent decades, policies and practices have been put in place to help eliminate the barriers and stereotypes and prejudices. The recent trends have resulted from advocacy efforts by individuals with physical and mental challenges and their supporters who have worked to establish the following important principles. 1. Society should make certain changes, such as requiring wheelchair access to public transportation and building entrances that allow people with physical and mental disabilities to take part more readily in businesses and social activities. 2. People should be evaluated on the basis of individual merit, not on stereotyped assumptions about disabilities. 3. To the extent that each is able, people with disabilities should have the same opportunities as people who do not have physical or mental challenges. A major action toward achieving these goals was the passage by Congress in 1990 of the Americans with Disabilities Act, a law prohibiting discrimination against people with physical or mental disabilities in the workplace, transportation, public accommodations, and telecommunications. Some provisions of the Act require employers with 15 or more employees to provide qualified individuals with disabilities an equal opportunity to benefit from employment-related opportunities available to others. State and local governments to follow specific architectural standards both in new construction and in the alteration of their buildings. They also must provide access in inaccessible older buildings and communicate effectively with people who have hearing, vision, or speech disabilities. Telephone companies to establish telecommunication relay services, TRS, that enable callers with hearing and speech difficulties to communicate through a third-party communications assistant. In addition, the Workforce Investment Act of 1998 ensures that any information posted on a website by a government agency must meet certain standards for accessibility for those with a disability.